Good morning. My name is Becky Mendenhall, and I have been a nurse for about 10 years. And I am right now the nursing supervisor for Holy Angels in Belmont, North Carolina. It's actually a facility that takes care of intellectually and developmentally disabled children and adults. I love my job, I'm passionate about it, and whenever we had this assignment, I really felt like the lack of clinical skills for some of the nurses that actually have to care for these individuals is becoming a real problem. And actually, it was brought to my attention again this week by a coworker about this kind of critical need that we have at our facility right now. So, um, without further ado, I will start my presentation. And I'm sorry I have to kind of hold my laptop up like this in order to kind of get it all on camera here. We've been quarantining at home, so this is kind of the clean side of my bedroom. Um, Clinical Skills Validation in Nursing, presented by me, Becky Mendenhall, RN. The nursing problem. How can nursing skills be mastered and validated through competency at a residential facility? This is the big question, and the key problem is that the licensed nurses lack the clinical skills necessary to perform job duties and tasks essential to caring for the residents. The infrequency of use of skills may be the reason for the problem, but competency must be met for the safety of both the residents and the staff. Dr. Benner's 5 levels of capabilities are novice, advanced beginner, competent, proficient, and expert. And the nurses need to be at competent or proficient, if not expert level, in order to be successful at our facility. And that is one of the big things that I really want to push with the nurses here at Holy Angels, is that we must be competent. If nothing else, we must at least meet that competency. I understand that we're going to have beginner nurses and that we're going to have expert nurses, but all the nurses need to at least get to that kind of median level, so that whenever a beginner nurse is left alone for any amount of time and is responsible for a catheter change or a blood draw or an IV start, or even a tracheostomy change, they need to be comfortable and competent in order to do those things, so that the expert nurses, kind of like myself, are not called at home on our days off to come in to handle something that should be able to be carried out by any registered nurse at the facility. The literature review table, I will not go into depth, though I'll just kind of briefly talk about each article. The first article is the gap between nursing education and clinical skills. And this article, kind of in a really brief summary, pretty much says that new nurses, whenever they're ready for the workplace, sometimes there is still that gap between their clinical experience, education, and like the reality of the situation. I do feel like this is very relevant to Holy Angels and to our job, because we do get a lot of new nurses, and we do get quite a few new nurses who have great skills. They just haven't completely mastered them yet, and we want to get them to that comfort level. Then there's also the nurse's perception of unit-based competency assessment compared to traditional skills fair. This article took and it basically divided it into the two different ways of completing a competency, and compared the two, and really and truly didn't come up with whether one was better than the other, but that either one is better than not having a competency at all, was kind of the main gist of that article. Either one of those would be better, having a unit-based assessment or a skills fair. Something is better than nothing. And one of the big things that I want to drive home to Holy Angels is that we need something. At this point, I don't think it really matters exactly what, but we need to have something in place to make sure that our nurses are successful with their skills. The third article is the challenges of upskilling healthcare assistants in community nursing. Um, this one just kind of talks about the delegation of skills to people that are not licensed nurses, whether that might be CNAs or a healthcare assistant. Here at Holy Angels, we use a lot of healthcare techs, and there are med techs, so they do a lot of the delivering or the administration of medications, of course, under the nurse's watchful eye. However, this becomes problematic because how much of the nursing are we taking away from nurses and putting onto someone that's non-licensed? I think it's something that we need to be careful about and that we might need to reevaluate in the future, especially with the way things are looking for nurses right this moment. The next article was the self-evaluation of nurses' clinical competency based on Benner's theory. This basically went through and just kind of summarized Dr. Benner's theory and then explained how nurses need to be able to kind of do a self-evaluation and decide where they are according to Dr. Benner's theory. Of course, you know, a novice nurse, hopefully she would know she's a novice or an advanced beginner. I think that the gray area becomes, are you competent, proficient, or an expert? Whenever you do reach those higher levels, I think it does, you get a certain confidence level as to say, yes, at this point in my career, I'm an expert level nurse. I myself, I would probably consider myself somewhere between proficient and expert. I don't feel like I have quite enough knowledge base. Maybe I would think a skilled nurse like myself with maybe a master's would be very expert level. I'm very skilled. I can start IV, I can draw blood, I can change trachs, I can do all the skills. But sometimes I feel like maybe I just need a little more education, hence achieving this bachelor's degree. Will maybe propel me more into the expert level. But I think all the nurses need to be able to inwardly look and kind of self-evaluate where they are. Do I need more assistance? Do I need to work on this skill a little more? And then identify that and then be able to go and talk to another nurse and say, hey, let me watch you start that IV. You know, I really have trouble with that. Or they come to me all the time because I'm the person who changes trachs at our facility. So they come to me and they say, Becky, can I please watch you change a trach? I hear I need to learn from you if I'm going to learn to do it properly. And that I want them to do that. That is a goal. Go to a nurse who knows, find out how to do it the correct way, and then go from there. The next article is the use of a competence fair to validate nursing competence. This is what I'm going to get into for the recommendation. Of course, this article is just describing the educational initiative of using a competency fair. We've all been to one. We've all experienced what that's like, so I don't think I need to go through that. Stopping at the stations and just kind of really identifying your weak areas or getting refreshers in areas that you're already competent in. And then the next article, Nursing Competency Standards in Primary Healthcare, an Integrative Review. This one was actually just kind of more of a review of literature that I put in here because it brought together several different articles that talked about nursing competencies. It was a very good one. It's just kind of hard to summarize. And then the next article, are Benner's expert nurses near extinction? This just kind of asks about that level of skill acquisition and asks nurses to kind of, I guess, look inwardly again and figure out, are we moving in the appropriate stages with nurses? Are we expecting them to come out of school and immediately be competent or proficient? Are we letting them move through the stages from novice to advanced beginner to competent? And if we're not doing that, then how could we do that better? And then the next article, an innovative approach to educating nurses to clinical competence. And this was a randomized controlled trial. This one basically compared two groups of BSN prepared nurses, and they did a performance assessment tool and trying to figure out kind of that, again, the promotion of self-regulating and self-evaluation, trying to figure out how you can kind of within yourself decide that you have achieved clinical competence. And then the summary of the articles, I just wrote that multiple articles reviewed for this project suggested that some form of assessment is needed to validate nursing skills competency. Again, something is better than nothing. Right now at our facility, we have nothing. So we need something, whether that might be a self-evaluation, a skills fair. I kind of went down through the successful methods of validation of clinical skills according to the articles that I reviewed. The first one was a skills fair, kind of the traditional skills fair. The second was a self-assessment or evaluation. And the third was a unit-based competency assessment. And then I also wrote a combination of these methods proved to be the most successful and most aligned with beginners from novice to expert nurses. I am really recommending right now that we go with the skills fair, but I'll get to that in just a moment. My proposal statement says all licensed nurses in the facility need to be competent and able to demonstrate proficiency in clinical skills in order to maintain a safe environment for the resident and themselves. And clinical competency is one of the significant merits of nursing, and its evaluation can lead to recognition of fields requiring improvement. And that was a quote from Elami, a previous article. And then my recommendations with proposed implementation. The first recommendation that I have is for our facility to hold an annual competency fair. This would be a fair that would be designed and planned by the nurse managers, or even like myself, some of the supervisors. And we would decide what skills needed to be refreshed or validated during that skills fair. In my proposal paper, I came up with 8, but 8 that I had kind of loosely asked the other nurses in the facility, what do they feel like needs to be worked on the most? And then I just kind of compiled that list for the proposal paper. However, those 8 skills could be put with more, and we could have, a number of skills that we worked on during the competency fair. But I do think it would be something that would be successful, and it would definitely help the nurses that are not so competent feel more competent in the skills. And my suggestion for implementing the skills fair would be to develop a committee or small team of nursing leaders that would work together to develop the poster or PowerPoint presentations for each station. We would have a catheter insertion station, an IV start station, a lab draw station. I do apologize if you hear my little one in the other room. My older 3 kids are not here, and she's by herself, and she's making a lot of noise in there, even though I begged her to be quiet while Mommy did this. And then my second recommendation would be used in conjunction with the skills fair. However, it could be used independently if needed. And that would be the development of a self-assessment tool. We decided not to go with the peer assessment tool just because that could cause some conflict. And I do recognize that, whenever it comes down to nurses, we all have different skill levels. And, there's even times where you think, oh gosh, she's going in there to do this, I should go do that instead. But we've got to give each other the chance and, be kind to each other. So a peer assessment tool might not be the best thing to use. And I do recognize that. So I think a self-evaluation tool along with the skills fair, that way a nurse can kind of use that autonomy and really look inside themselves and say, hey, you know what, I know I am really, really good at putting Foley catheters in someone. That's a gift, but I can't start an IV, and I need to be able to start an IV. And so I think that that is another really, really great thing that we could do in addition to the skills fair. And my suggestion for implementing the assessment tool would be to develop one based on the identified skills that we're using in the competency fair, and then have just kind of a general area for the nurses to go down through and kind of figure out what exactly it is that they feel competent in. And then in conclusion, becoming a competent, proficient, or expert nurse, as Benner categorizes, does not happen overnight. It takes time, knowledge, and practice to master the skills and truly become an expert. Delegation to other nurses or healthcare assistants may not always be the best choice when there is a chance of losing one's own personal skills at risk. There are many ways to conclude whether or not a nurse is competent, and utilizing multiple methods of validation may be necessary. Not all nurses will achieve expert level in nursing, but competency and proficiency should be a goal for all nurses, regardless of experience or current practice. It is imperative that my facility looks closely at making policy changes that include a skills competency for nurses in order to maintain a safe work environment for residents and staff. Regardless of facility, all patients deserve to have a competent and skilled nurse caring for them, and nurses should strive daily to make that happen. In closing, the nurses need to feel confident and prepared when undertaking their roles in a life-changing environment. And that's a quote from Bennett in 2017. And then here are my 2 reference pages. And that is the end of my presentation. Thank you. And does anyone have any questions? And I can tell you whenever I do, because I am going to actually give this to my DON to see if she is kind of ready for me to initiate something like this. I don't know that we will necessarily use my PowerPoint. She usually kind of prefers to make her own thing, but I'm hoping she will kind of take some of what I've done and use it with our facility. If not, use this one exactly for our facility. I'm prepared to meet a lot of questions from the staff, as well as probably a lot of hesitancy from the staff, because for as many years as Holy Angels has been around, and as much of a reputable and respected company as it is, they have not had kind of that gold standard of making sure the nurses have all the skills that they need. There's nurses that have been there upwards of 17, 18 years that I've talked to that still don't feel comfortable going in and starting IVs or drawing blood or putting catheters in. And, you know, to me, that's sad. You've taken a part of your nursing and kind of forsaked it just because, you know, so much has been delegated in the past or given to another person. And I want them to feel that and to make sure that they're seeing within themselves that they can achieve expert nurse level. So anyway, that is the end of my presentation, and thank you very much.